Hello, I'm Dr. Mike Borgett, and welcome to the Doctor's Report. Again, the reason that we do the Doctor's Report here in our office is we want you to get the very best results while you're a patient here in this office. And we've come to the conclusion that when patients are well educated on the problem, how it's affecting their health, and then what we need to do to get it corrected, the procedures and protocols that we use to get the best results possible, when you're comfortable with those, you understand them, and we're on the same page, you're going to get better results. And we are a results-driven office, and we are very excited that you're here. What we're going to do is we're going to go through and explain how our healthcare system got in such shambles, why we see so much sickness and disease current day in this healthcare system, and then what the solution is to make sure that doesn't happen to you. We're going to go through a couple of case studies on how we get the spines into a better, strong, stable position and get people extremely healthy. After that, you'll be done with the doctor's report and we'll be ready to go over your individual x-rays and your care recommendations. The question we always like to start with is, besides your faith, what is the most important thing you have in your life? If you take a second to think about that, think about all the things that you value, all the things you work really hard to maintain. Some of those might be your time, might be finances, but I think if we're honest with ourselves, when you really think about this, one of the things that we should be valuing is our health. And we should be putting that up near the very, very, very top, because if you lose your health, and we know a lot of people that have, you literally give up everything to get your health back. And so this office is designed to put your health as the number one priority, except maybe your faith, and I agree with that. But we have to prioritize our lives around our health if we want to maintain that. And so the problem is if you look around our culture, if you look around just the society that we live in, we're not seeing a thriving, healthy society. In fact, we're seeing more sickness, more people taking medications unnecessarily, more suffering, and it's unnecessary. And so one of the things we're going to start with at the doctor's report here is we're going to go through and explain exactly how our healthcare system has gotten into really such shambles, and then what we can do to actually have a better approach to your overall health. Because at the end of the day, who's responsible for your health? And you should be answering you, right? We are responsible for our own health. Me as your wellness doctor, yes, I can guide you and instruct you and give you all the tools and the protocols that you need to be healthy, but at the end of the day, you're responsible for implementing those. You're in charge of your everyday lifestyle. And so when we look at our healthcare system, when do most people go to the doctor? What has to happen in order for them to say, you know what, I'm going to make an appointment, I'm going to go in there? And I think what most of you are going to say is that when you feel bad or when you are sick. And so when you go to the doctor, you go in, and the doctor is a very intelligent person, very, very educated, and they're going to ask you a health history. They're going to come up with some sort of diagnosis, maybe off of testing. They might look in your eyes, your ears, your nose, throat, maybe do some blood work, but something tangible is going to come, and they're going to come up with a diagnosis. And so what's the number one thing they're going to do based off of their training and their procedures and protocols? They're going to write you a prescription. And so that prescription is designed to make the symptoms go away. It's designed to make you feel better. But let's just say it doesn't work. Let's say you're still feeling bad. Then you go back to the doctor. They come up with another diagnosis, or they might try a different prescription based off the same diagnosis designed to make you feel better. So then you go fill another prescription. You try that. And let's say you don't feel any better with that.